Joining Dr. Shallow and me now is Michael Beert, a cellist who was also in a car accident years ago. Welcome.
Well, thank you for having me.
Absolutely. So what made you start seeing a chiropractor?
Well, I was experiencing pain on the right shoulder up through the right part of the neck, and it seemed to be exacerbated as I was playing the cello more and more.
Now, was yours caused from the car accident, do you think, or unrelated?
I think it was definitely related.
Dr. Shaw, you're also a musician, right?
That's correct.
What do you play?
I play the violin.
Oh, the violin, okay. And you said just having the work done on yourself has helped as well.
Oh, absolutely. Yeah.
Well, once you start having these chiropractic treatments, how often do you have to go back?
It depends. We have been doing less and less treatment as I've been getting more strength in my right arm and feeling much better about my playing and knowing how to relax a lot more.
What can people who are coming to you for the first time expect?
It depends a little bit on what kind of condition they're in right then. Most of the time, children without symptoms, if there's a problem with the spine, we correct the problem in the spine. And most of the time, kids are done like right now, you know, as soon as you do it. And they'll hold forever, even through football season. And, but adults, if it's been there for a decade or more, there's more of a learning curve in the tissues. And so we see people more frequently in the first 4 weeks until the evidence is there that things are holding and things are improving.
Now, I would think one of the hardest things for people to get used to is the fact that a lot of insurance plans still don't cover chiropractics. Or are you seeing more and more today that are helping people get through the door and being able to pay for the bill?
What I encourage people to do is to just invest in themselves. And if their insurance company wants to come along and do that too. In fact, research shows that insurance companies can save millions of dollars by having everybody go to chiropractors. There's 85% less drug use, 60% less hospitalizations, and I think about 50% fewer surgical procedures done on people who first go to chiropractors. Isn't that interesting? And so insurance companies should be perking up their ears.
Tell us about this Nucca procedure that you perform.
Right, the Nucca, it stands for National Upper Cervical Chiropractic Association. And the Nucca procedure tells us how to take the x-rays properly so that we can reproduce that continually. And that tells us how to correct the problem of the misalignments up here. And then the Nucca procedure also tells us how to correct it in terms of the force that's used. Our patients don't feel the force. I had one patient just about attack me because he thought that I didn't do anything. But then his wife asked him, well, how's your neck feel? And he goes, well, it doesn't hurt anymore. And so, you know, that was proof to him that I did something. And then, of course, I re-x-rayed, and that was proof to me that I did something.
So it's a softer approach, and why do you take that approach?
Because you're working with the brainstem. You have to have a very controlled force go in. Sometimes you need to move that bone just the thickness of a hair. And that is the difference between success and failure. If it's just a thickness of a hair out of position, it'll render all your efforts pointless. You can do all kinds of other modalities and you won't get anywhere. But if we have to have a very controlled adjustment to get that spine balanced again. And when we're successful with it, it's going to stay put.
And you do this procedure, do many other chiropractors in the area, or is that what separates you from them?
I'm the only one in Rockford at this point that uses the Nucca procedure.
Michael, you'd recommend this to your friends and family?
Very highly. I have.
Wonderful. Thank you so much for being on the show. And thank you so much, Dr. Shaw, for sharing with us today.
Thank you.